I'm David Kutz. So today I'm going to be talking about a very, very complex thing, and I'm going to try to boil it down to really, really simple terms. Mainly because not just because it's easier to understand, but the good news is that the interventions, the way to help people, is actually rather straightforward, which is great, because the concepts are going to seem a little overwhelming, like we're all doomed, we can't help. But the great news is that's not true at all. And actually, it's more of sort of the head and the body, more than just the heart too. So basically, I'm going to focus on sort of how, in sort of a bidirectional relationship, sort of how mental health conditions affect bodily systems. And then I'll kind of go into how different medical conditions affect mental health conditions. And obviously it's a vicious cycle, bidirectional relationship. The other thing that's really interesting, and the theme that's going to keep popping up, is there's like kind of one epicenter in the body, for the most part, that relates the brain and the body. And a lot of the interventions essentially work because they impact this particular epicenter. And I'll get to all of that. Okay. The other thing is that sort of this idea that there's sort of the brain and the body, I think even though as providers we understand, we've probably been taught over and over again, that that's not the case, that everything's connected. But I do think that in general in society, there's very much this idea that they're separated. That, if I'm really sick, I'll go see my doctor, my MD, and if I'm somehow like crazy or mentally ill or something, then I have to go see another provider, and that somehow they're qualitatively different. And I think that that's one of the major things that we can do is sort of dispel this for patients and get them to understand that they're one and the same, that health outcomes involve both of these things. So really quickly, so in terms of sort of the mental health conditions, I broke these down into a little more specific things because I think some people in different settings it would be important for them to understand, like when they're seeing something, if someone's saying like, I can't stop checking, or I worry, or things like that, that we just sort of understand that sort of the ideas of depression and anxiety can involve lots of different things. But again, in the spirit of boiling things down, I think basically really everything that I'm going to be talking about in terms of mental health conditions, we can just boil down to chronic stress. So if we can assess somebody and it looks like they're having issues with chronic emotional stress, to me that's a red flag. That's enough to help them, to try to intervene. So in terms of like the impacts of just depression on health conditions, we see that depression is actually incredibly common. In fact, these studies I think kind of underreport how common it is. I've read things where it was reported that like women, about 25% of women will suffer from a major depressive disorder at some point in their lives, and about 20% of males. And that may just be because difference in reporting also. But this is something that I think we can do to help our patients, is really explain, you're not alone. Like, this is incredibly common, even though it may not be something that people are talking a lot about. And of course, there's going to be cultural differences. In some cultures, people talk about it a lot. In some cultures, they don't talk about it at all. In terms of things like cardiovascular health, we see that individuals who have even mild depressive symptoms are much higher risk for cardiovascular events. And for people that have moderate to severe depression, the risk for cardiovascular events is incredibly high. And I actually had to like kind of double check the data on this just because I was like, this is insane. This is crazy. And so to put it in perspective, because a lot of times we hear a lot about like diabetes, for example. And I know that breaking down data can be very complicated. So again, this is probably very oversimplified, but just to put it in perspective, in the year 2016, about 88,000 deaths were attributed to anxiety or depression as sort of a direct factor, whereas 103,000 were attributed to diabetes. And again, I didn't break down the studies and look and read the description sections, but it does give you an idea like, wow, this is not some little thing here. This is. Let's see. Oops. I think I may have lost the. Yeah, hold on. Okay. Okay. Perfect. And so this is sort of where I get to the epicenter, right? So, and we're going to see like with depression and anxiety, and I'll probably go through this pretty quickly, that depression, anxiety, chronic stress essentially affects the body in a very particular way. And the way that I think most research focuses on is what's called this, the HPA axis. So the hypothalamus, the pituitary gland, and the adrenal glands. And this is the part of the body primary part of the body that responds to stress. And what happens is that chronic stress, whether it's, symptoms of depression or the fight or flight response with anxiety, what happens is that over time, it can deregulate this system. The system is normally a negative feedback system. So generally and mainly what it does is it eventually relates to the release of cortisol, the stress hormone. So normally when cortisol levels are high in the blood, the HPA axis limits the production of cortisol. So it provides a homeostatic balance. But what we've found through thousands of research studies is that chronic stress, mental health stress, dysregulates the system. And so cortisol is essentially over-released. There's an excess of cortisol in the system. And this leads to like a domino effect, this huge impact on the body, on multiple body systems. It leads to inflammation. It leads to dysregulation of all of these different systems, including the cardiac, autoimmune, and the endocrine system. And the HPA axis is actually a neuroendocrine system. And so this is going to be a theme that's going to keep popping up. So in terms of just sort of behavioral changes, and this is why as a mental health provider, we have to be, I think we can be an integral part of treatment for people with different medical conditions, is it leads to incredible, huge, impactful behavioral changes. And these are pretty common. And eventually, I'm going to relate this to sort of what can we do about it? What kind of questions can we ask? Let's say if we're a medical provider or we work in a primary care office. And again, some of the other impacts that it has: huge increase with cardiovascular events. It can affect endocrine disorders, diabetes, thyroid issues, autoimmune problems, which also lead to similar issues, and just a really huge impact on the quality of life. Again, anxiety, not surprising, incredibly common. And what they found is, again, not surprisingly, with people with chronic anxiety have a much higher rate of a medical condition of some kind. And again, like the research, we're talking in huge numbers, and this is data. So it's not like if you know somebody that has panic attacks, you're going to be like, oh my God, this person's going to have a heart attack. But in general, when you're dealing with patients and in clinical settings, I think it just sort of speaks to how important it is to make sure that we're aware of sort of the different multidisciplinary help we can get. Same thing as depression. That basically chronic anxiety, sort of kicking in that fight or flight response over time dysregulates the homeostasis of this HPA axis. So cortisol is excessively produced, pumped into the bloodstream, and then starts having its effect on all these bodily systems. And again, inflammation is a part of that. And again, these are some of the specific, similar to depression, all these sort of different systems that can be affected. So we can have increased rates of diabetes, hypo or hyperthyroidism. It dysregulates the immune system. Of course, very common with people with anxiety, they can have gastrointestinal problems. And then it can also affect sort of bone development and growth and maintaining bone density. And again, not surprisingly, when people are very anxious, especially if they're moderate to severe anxiety, it causes all these potential issues, which in this vicious cycle can kind of feed back and create more problems and create more physical problems. And similar to depression, it can affect cardiovascular, autoimmune, endocrine system, among others. So what I'm going to do is now kind of switch really quickly to sort of these common medical issues and how it impacts mental health. And I lost some time here, so I'm going to go quickly. So really quickly. So cardiac events that basically, if somebody, that the incidence of depression and anxiety following cardiac events is very high and significantly impacts the prognosis following a cardiac event. Here it says that there can be a twofold increase. I've actually seen some studies where there's even a threefold increase in further cardiac events and increase in mortality. Oh, and also the things to look out for. If someone has a previous history of depression, socioeconomic strains, huge. And interestingly, if the younger the person is at the time of the cardiac event, the more likely they may suffer from depression and anxiety afterwards. So if you're in your 50s versus your 80s, there's a much higher chance of that. Again, I'm going to fly through this just because I need to get to the part that relates to me. So again, autoimmune disorders, chronic pain, and endocrine disorders, all through this, through the HPA axis, are part of this feedback system. And again, it's sort of a chicken and the egg thing, but basically if you're having medical issues that relate to these systems, among others, and it causes mental health issues, or you're having mental health issues that increase the chance of these medical problems, it essentially is likely, if it's chronic, to dysregulate this HPA axis. All right, so this is the good part. I have 6 minutes. So understandably, the approach is biopsychosocial. What does this mean, right? So probably I'm guessing most of you take care of the bio part, right? So usually it's a mental health professional of some kind or some sort of social support system that can help with the psychological and the social approach. And they're all crucial and important, and they all significantly affect health outcomes. And these are some of the things, I'll go into specifics of what we can do. They're really simple, and they can take just a few minutes, which is the important part. Ask questions and normalize the experience and encourage getting help. Okay, so with depression and anxiety, often probably the best thing we don't want to do is just ask the patient, well, have you been feeling depressed or are you anxious? Because a lot of people aren't really going to understand what that even means. So these are some of the really helpful things that we can ask, like, what are your sleep patterns like? Are you able to enjoy things that you normally enjoy? Are you motivated? Are you kind of keeping up with things in school or at work? Again, with anxiety, sleep patterns, really important. Do you worry a lot? Do you have chronic headaches, chronic stomach problems? These are some of the things I think patients can relate to more than just like, are you depressed or are you anxious? Pay attention to social factors. Regardless of where we work, if somebody is living in a difficult situation, whether it's situational because they're going through a divorce or something, or whether it has to do with financial strain, these are really important to pay attention to. And you can even ask them, well, is this affecting your quality of life? Is this preventing you from spending time with your family or going to school, or have you been missing work? These sort of things are really helpful that I think people can relate to. And like I said, this can be a very quick assessment. I think you can do this in 5 minutes in the office. And there are self-report scales. If you guys are interested, I can give you more information, email those to you. I don't know realistically if people are going to have like depression inventories in their office that they're giving patients, but you can do that for sure. Again, I think it's really important for us as providers to get across to our patients that there's no longer this idea like it's just in my head. Because I think people really, really still have this belief. And I think we're in a really unique position as professionals to help sort of destigmatize that and normalize that and help people understand that the science doesn't split the body and the brain. The science has shown how incredibly integrative those two systems are. The other thing is just so we can explain to people just how common it is that people suffer from struggles to feel motivated or sleep problems, or people get anxious and worry about stuff, that's incredibly common. And especially if someone's facing, let's say they've had a heart attack, or they've been diagnosed with COPD, or they have a thyroid issue, to explain that when we're facing medical issues, most people have some sort of emotional reaction to that it's really common, and that it's okay and important for the health outcomes to seek help. And even, offices may want to have referral lists or offer help and encourage, again, sort of how normal and how crucial and helpful it is. And if people understand that this is all part of your medical care, that the mental health aspect is part of that medical care, I think it'll help them feel a little more comfortable. If they're talking to family members, they don't have to say to their family member, well, they sent me to a shrink. It could be, well, I'm going to see this other doctor who's part of helping me with my diabetes or helping me, recover from my heart attack. So really specific interventions. These are some of, really, I would say any empirically supported psychotherapy can be helpful. These are some of the main ones. Cognitive behavioral therapy, there's mindfulness-based cognitive therapy, and then interpersonal therapy, acceptance commitment therapy, and dialectical behavior therapy. Basically, what all these things do are they're very symptom-oriented treatments. So there's not really a lot of analysis or anything. They're very practical, more essentially geared towards helping people as quickly as possible. And the idea is sort of learning how to recognize how your thoughts affect your behaviors and your emotions, and learning to change behaviors and impact and improve your quality of life. Medication management can also be crucial and important. In terms of, especially with cardiac patients, generally the antidepressants like the SSRIs, the SNRIs, mirtazapine, even for anxiety, hydroxyzine, antihistamine can be safe generally. I would say aside from that, you probably want to double check, like if you're going to be using an antipsychotic, a mood stabilizer, anything like that, to just be very careful because they can affect arrhythmias and QT prolongation and things like that. And really, what's really interesting about medication management, and what's super helpful, both about, well, the SSRIs, for example, what we find is the reason actually that it seems to be helpful for depression and anxiety is not so much that they may increase levels of norepinephrine or serotonin, but they eventually regulate the HPA axis. So even with these medications, the reason that sometimes these antidepressants take 6 weeks to work is because that's about how long it takes to start to regulate the release of cortisol, which is interesting because it kind of goes back to sort of the epicenter of this connection in the first place. Last thing, really quickly, what I'll say before we get to questions is like, fully I understand. I mean, I'm very fortunate. I get to usually meet with my patients for like an hour, half an hour at is the least amount of time. So having 10, 15 minutes with somebody is incredibly difficult. You guys already have way too much to do probably. But what I would encourage everyone to think about is just these really quick questions and to be open to understanding how important the patient's responses can be. If they're having major sleep problems, if they're having problems with obesity, if they're going through incredible stressors, financial stressors, to understand that either that the risks that this can pose in creating medical problems, or if someone's had a medical event or dealing with a medical issue, if they're responding and having some of these mental health symptoms, to refer, to find help. You don't have to do it. If you can, I know you only have like 15 minutes with somebody, you don't have to do therapy with them, but just to reach out to a mental health care provider. And overall, generally, having any referral to any licensed mental health care provider seems to have a massive impact. In the research that I looked at, they weren't breaking it down between psychiatrists and psychologists, social workers and therapists. They basically say, someone who has visited with a mental health provider significantly improved health outcomes. That's it. Yeah.
Are there any questions for Dr. Kutz?
SSE under anxiety.
Under anxiety. Oh, social phobia.
Oh, okay.
Yeah. Sorry. Yeah. And really, like I said, in general, what we're really looking for is chronic stress, or in any form that it's taking, whether if even it's situational, like they're going through a divorce, or whether they have OCD, something very specific, or, that basically we just have to be really careful if people are stressed out. I mean, even if we can even just communicate it that way to people, we don't even have to get specific with our patients.
Lead you into, lead that patient into that direction.
In terms of like how to make the referrals, like.
You make a referral for
Right.
therapy.
Yeah.
How do you follow through? How do you know that patient has followed through? And
That's a good question. I mean, I work just as a private practitioner, as a psychologist. So, I mean, that's a good question. I mean, I guess ideally there would be some sort of follow-up. I guess if the patient comes back in, I guess the best probably realistically you can probably do is, and to really reinforce how important it is to probably say, hey, did you end up, getting in contact with anybody? I mean, I definitely contact the medical provider after I see them. Like if they've sent something to me, like the cardiologist, for example. But I also prescribe. So a lot of times I have to check with them to make sure they're okay with whatever I'm prescribing.
I just feel like sometimes we know what they need.
Right.
And we know how they should go about getting it, but we don't really know, did that process actually happen?
Yeah.
So they kind of circle back around and the same problems occur.
Yeah. I mean, I think maybe they're like if you wrote a name down and a phone number and handed it to them. I mean, I think little things like that can, I think, have an impact. Like as opposed to saying, I think you could benefit from seeing a therapist. Like that probably just flies over their head. As opposed to, I like this person, or here's a list of people we really like. You know, I encourage you to give them a call. You know, but it would be wonderful if we could follow. I mean, like we could follow up and be like, hey, did you, yeah.
So do you have any identifying factors that would identify someone that's high priority for intervention, such as they may be suicidal?
Yeah, that's a tough. I mean, that I think. I mean, in some ways, as a mental health provider, I mean, we have the time to really get into that, and I mean, we ask those questions. I mean, as a, sort of for a cardiologist or a primary care doctor, I don't know how realistically whether you're going to get into that or not with them. I mean, obviously, if you get that sense, I mean, if you get the sense that someone's not safe, well, then, I mean, you probably want to have some sort of, system in place to make sure that that person gets help. I guess it depends on how immediate the risk is. So in that case, like that may be a case where an office really wants to document that they followed up with the person and maybe even ask the patient when you sign a release with that mental health provider so that provider can let us know you've seen them, short of someone that actually needs to be like transferred to an inpatient unit right away or something like that. But I mean, for a mental health provider, I mean, we regularly will check in with the person, but I guess you can kind of get an idea, like if a person's not sleeping or they're engaging in really risky behaviors, whether substance abuse or they're having manic or hypomanic symptoms, or they come in and, their appearance looks disheveled or something like that. I mean, you can, maybe want to ask more questions if that's the case. I hope that answers it. Yeah.
We have time for one more question. Okay, right here.
How mental health affects vagal tone, vagotonia, and atrial fibrillation?
Yeah, I mean, there is. I think. I mean, I think what they found is like that this like chronic stress and sort of this dysregulation of the HPA axis can affect everything in terms of cardiac issues, heart rate, blood pressure, buildup of plaque. I assume I assume vagal tone also, but that I don't know specifically. Yeah, but I bet you could easily just like look that up and if they've done research. But usually I see most of the research has to do with like coronary artery disease or cardiovascular disease or heart attacks, sort of maybe more broad cardiac issues. Yeah.
Thank you.
Mm-hmm.
Thank you very much, Dr. Kutz.